E tupu e rea, ka tupu koe he tangata. Ka ruru e koe ki te tuauri, hei amonga mōhau ki te pūtake o ngā kōrero. E aku nui, e aku rahi, aku whakatamarahi ki te rangi, tēnā koutou, tēnā koutou, tēnā koutou. Tēnā koutou katoa me te hokinga mahara, ki ngā tōtara haimata o te hauora, kāre i kona i te rānei. Kia Irihaupiti Ramsden, kia Iru Pomare, kia Rob Kupama, rātau e para te huarahi mo tērā whakatipuranga kōrero atu ki te pō. Ko te whakaaro ki a rātau, mo i mai rā oki ai. Ko rātau ki a rātau, ko tātou ki a tātou. Huri tai ā whio nei i te motu, tēnā koutou katoa. Me hoki anō ki a tātou te hungora, me te mihi atu ki tērā mātanga hauora o tātou, ki a te ahorangi tā meihana jury. Nāna i whiriwhiri ngā kupu nei e meana ko pai ora ki roto i a te whakahaunga o he korowai oranga. O te atura e mihi ana ki ngā take nunui kei te whakahaunga ngea e tō tātou nei hao auora. Arā, ko te traipuna o Waitangi me tō rātau ripoata hauora. O te atura ki a whakamaua koe a ka tāpai ngē atu te ara ki mua mo tātou. Hoi anō, tainō ki te rānei, ko tata tātou ki tō tātou nei pire hau ki a te pire pai ora. Nā rere e mihi ana ki a koutou katoa, koutou kare i kona i te rānei, koutou ka tai mai, tainō ki tō tātou nei matanga ki a tā meihana, e mihi ana ki a koutou. Nā rera, tēnā koutou, tēnā koutou, tēnā koutou katoa. Kia ora everybody and welcome. Welcome to the first of our information sessions on the health and disability reforms, and in particular, embedding Te Tiriti or Waitangi in our system. And just to let you know, I acknowledged from a generation ago, people of the calibre of Irihaupiti Ramsden, of Iru Pomare, of Rob Cooper, even most recently Mona Jackson, as people who have helped shape not only hauora, but our understanding of Te Tiriti or Waitangi, and acknowledging that if they were here today, the excitement I'm sure they would feel as we're about to engage and embark on our next journey in embracing and incorporating Te Tiriti or Waitangi into our hauora. I also acknowledge the work of Professor Sir Mason Jury in his seminal work in reviewing he korowai oranga and encapsulated the key direction for all of us in pai ora that led to work that came later on by the Waitangi Tribunal in Y2575, the development of whakamaua, the Māori Health Action Plan, and also, most importantly, and the basis of our discussion today, the new pai ora legislation. I'd like to welcome today the Honourable Andrew Little, Dr. Ashley Bloomfield, and Riana Manuel, who come along today to share their insights and observations and expectations and aspirations as we move towards an exciting development in the development of Te Tiriti or Waitangi. For those of you who are online, you will be able to participate and provide questions into this process through Slido, and I invite you to do so. Also, if there are questions that we aren't able to respond to today, we will gather those together and provide online responses after this. Without further ado, I'd like to now hand over to Dr. Ashley Bloomfield. Kia ora tātou.
Well, kia ora koutou katoa. Thank you very much, John. Great pleasure to be here alongside you. Welcome to you, Minister Little. Nice to have you here up at Manatū Hauora, and my colleague Riana Manuel, who is the Chief Executive of the Interim Māori Health Authority. It's a real pleasure to be here today. I have to say it's a great opportunity to be speaking at this forum. I know many of you will be aware that whilst I'm finishing up as the Director General, I still have 3 months in the role. In a global pandemic, that can be a long time, but it also means I'm very excited about continuing to be involved in the implementation of these reforms to the system. And of course, they're not starting now, nor on 1 July, but they're already well underway, as you will hear today. So, I've always been a strong proponent of New Zealand's health and disability system. It's by no means perfect, but it is one that delivers very good outcomes for many New Zealanders. However, like many, if not all people working in that system, and indeed New Zealanders, we have aspirations to do even better. And these reforms offer an opportunity to do just that, to achieve pai ora, healthy futures for all New Zealanders. A system that is responsive to people and their needs, whatever their circumstances. The reforms underpinning them have this special relationship between Māori and the Crown, which we know exists under Te Tiriti or Waitangi. So an inclusive Te Tiriti health system will help us achieve pai ora through enabling mana motuhake and tino rangatiratanga. And we will hear more on this, and I know this will be the subject of some of your questions today, so we look forward to receiving those. There's a clear responsibility and commitment to continuing the good work that John has outlined that has been done in the past and laid down by some of those great names in Māori health development in Aotearoa, New Zealand. And more recently, the development of the Māori Health Action Plan Whakamoa. And that lays out some of the key actions that are already underway to improve hauora Māori services, to services for other groups of people who currently don't get the access that they should, like Pacific people, disabled people, tangata whaikaha. And where this reform provides an opportunity for us to not just recommit to, but to make substantial progress in those areas. We're not starting with nothing. There has been a lot of great work already happen within our healthcare system, and in particular over the last 2 years in our response to the pandemic, I believe we've seen some step changes in the way our system has responded to inequities. And the idea, of course, is that we build on those gains that have been made. But it is an opportunity for us to revisit how our system can better ensure equitable access to, experience of, and outcomes from care. And our role as the Ministry of Health as the key strategic advisor to government, as a key kaitiaki guardian for the system, is to ensure that the system is delivering for New Zealanders in the future. So one of our most important roles will be monitoring overall system outcomes. And we're working actively on how that will look different in the future as we move on 1 July to that new system. Believe me, we will remain steadfast in ensuring that the government's health priorities are met and that the system delivers for the longer term health needs for all New Zealanders. One of the key documents that underpins the Health Minister's priorities for the future system is the interim government policy statement, and that lays out really the government's priorities as we journey towards pai ora. So I'd like to hand over now to Minister Little to explain about the government's goals and priorities for the new system, and then after Minister Little we'll be over to my colleague Riana Manuel to offer some insights as well. Kia ora, Minister.
Kia ora, Dr. Bloomfield. Kia ora tātou katoa. Good afternoon. It's a great pleasure to be here with Ashley Bloomfield, with John Whaanga and with Riana Manuel to talk about the start now of the process of bringing the government policy statement, and as we head towards the 1st of July, the introduction of the new operating model for our health system. When the government reviewed the report of the Health and Disability System Review, it looked very closely at what that report told us, as indeed many others have told us, about the performance of our health system, which has done very well, but has also seen a growing share of our population continue to miss out on frontline health care, particularly primary health care, and a system that has been built up over many years to do a number of very important things, but still not addressing some of the fundamental aspects of broader well-being that we would expect in a country of our size in the 21st century. One of the other things that became apparent was too, for a country that understanding its history and coming to terms in the last 30 or 40 years with the Treaty of Waitangi and the founding role that that document plays in this country and us as a nation state, is to make sure that the Crown is truly honouring its obligations under the treaty. And so we said as one of the first priorities of the reforms that we must ensure that the way our health system operates truly honours and embeds the obligations of the Crown under Te Tiriti. Of the range of recommendations that the government picked up, which was establishing Health New Zealand as the body that brings together the 20 district health boards into one organisation, and the establishment of a Māori Health Authority to reflect a set of priorities and obligations about that. It's the job we are giving the Māori Health Authority that I think gives us the opportunity for a much more powerful response to lift health and health services and access to health for Māori. As Dr. Bloomfield acknowledged too, we have population groups within Aotearoa New Zealand for whom there needs to be greater emphasis, more work, greater priority to make sure that our health system is delivering, Pacific peoples, ethnic minorities and others. But for Māori, to whom we have an obligation under Te Tiriti, there's not just a question about providing more or better health services, it's also about a voice in the system and a way to express rangatiratanga and the way we set up the system. And so this is one of the things that we want to ensure that the reforms do. We have an opportunity to now, I think, with a strengthened Health New Zealand, with the Māori Health Authority bringing its voice and its mana to decisions about health, to really address some of the long-standing inequities in healthcare and health outcomes that we've seen in this country. As Dr. Bloomfield also acknowledged, we have a number of what we might call accountability documents. We have the government policy statement, which we're in the process of pulling together, and we'll start to socialise that and talk more about that in the weeks to come. But that is the document that sets out the government of the day's objectives and aims for the health system through the structure and the entities that we have in place. In addition to Health New Zealand and the Māori Health Authority, of course, one of the other new dimensions of the operating model will be a public health agency supported by the Ministry and providing leadership in our public health endeavours through the consolidation of the public health units within Health New Zealand. And all of that, of course, under the stewardship of the Ministry of Health, whose role will become very much the lead of the system, providing the policy support and advice to ministers, providing that system stewardship and enabling the Māori Health Authority and Health NZ to get on with their task and their mission of running excellent health services and improving health outcomes for all of Aotearoa New Zealand. Within that system, there must be clear decision-making roles and places for Māori, which will be expressed not only through the Māori Health Authority, but through iwi Māori partnership boards, drawing on the strength of the wisdom and mātauranga from Māori. For it to work, all of the entities must work closely together. And from my position as Minister, from what I have observed in the establishment phase, what I see is a Māori Health Authority and Health NZ working incredibly closely together, as indeed they must, for both organisations to succeed, and working closely with the Ministry of Health, because, as I said, all must work with shared objectives and common goals and work closely together. The strength of those relationships is going to be absolutely vital to changing what we do. So I will leave my comments there, except to say I think over the next few weeks, as we head towards the 1st of July, the date that we plan to, subject to the passage of legislation, to cut over to the new operating model, I think there are some hugely exciting opportunities for all of Aotearoa New Zealand as we think about the health services, as we think about the health needs those that are met, those that are unmet, and about how we address some long-standing concerns in that regard. And I look forward to the ongoing discussion about how we continue to achieve the best health system, to achieve pai ora, healthy futures for all New Zealanders. Kia ora tātou.
O tēnā rā koutou katoa, e rere ana tēnei mihi mata kui kia koutou katoa e mātakitaki ana. Kia koe John mo tō tūwheratanga o tēnei wahanga, e mihi atu ana kia koe e wha, me koe hoki Minister Little, mō whakaaro, mō tō tautoko o tēnei kaupapa, me koe hoki, tākuta Ashley Bloomfield. Engari, ko Riana Manuel tōku ingoa, no pare hauraki a hau, e hariko ana hau ki te kōrero I raro I te maru o tēnei whare I tēnei rangi. My name's Riana, and of course a special mihi to everybody out there. Can I just start by firstly acknowledging the amazing work that has been undertaken over these last few years by all of the sector, the workforce, the communities in general. We're absolutely aware that there is so much going on in our communities, and we're actually excited by that at the same time because it's given rise to some really excellent models out there in the communities which uphold Te Tiriti partnership, if you like. So as the interim CE for Māori Health Authority, one of the exciting and challenging aspects of this role will be making sure that whilst as a Crown entity we are not one of the Te Tiriti partners, but that relationship between iwi and the Crown will underpin the relationship that myself and my colleagues at Health New Zealand will have, including the partnerships we have with Te Manatū Hauora or the Ministry of Health as well. I'd like to acknowledge that Margie Upper at the moment passes her apologies to everybody. She is on holiday at the moment, and of course sends everybody well wishes as well. So I think the thing that is important to me is when we acknowledge that we've historically had a health system that has not met the obligations for Māori under Te Tiriti, the important thing is to acknowledge now that we see the reform as part of the action to take and moving forward from there, to start creating opportunities and a system that will honour Te Tiriti, will uphold the rights of Māori and give effect to the treaty principles articulated by the Waitangi Tribunal. And that means sharing resources, tackling sharing power and resources, and of course tackling racism within the system to ensure that we remove bias, we make sure that there is adequate access to health services, particularly for Māori in this relationship, but other parts of our community who also have experienced inequities in access to these services as well. We want to develop authentic tangata whenua and tangata tiriti partnerships to realise Māori aspirations, and of course to embed those principles for the time ahead of us, to make sure that when we develop a system that's based on understanding that relationship and those inequities, that it actually has a massive benefit for all of our whānau here in Aotearoa, a health system that better serves everybody by acknowledging that very special relationship between both the Crown and iwi, and acknowledging Te Tiriti and the place that it plays here in this mahi of the reforms. So that's kind of the main thing that I wanted to bed in. The Māori Health Authority will work on a number of key documents, as Minister Little has outlined, and we'll be working hard with all of these organisations to ensure that we uphold our responsibilities as a good Te Tiriti partner as well. We want to make sure that we bring forward not just what currently exists in the system, but that we look at those innovative examples that we've experienced over the last particularly couple of years, that we reach into communities, that we get services more locally exposed, and making sure that those good partnerships, such as localities, will be explored, invested in, and create opportunities to ensure people, no matter which community you live in, be it rural, be it urban, whether you are a person with disabilities, whether you are Māori, Pacifica, that these are groups who will have better access as a result of this kind of collaborative and collective approach to improving our health system. Tēnā rā koutou.
Tēnā koe, tēnā koutou katoa, tēnā koutou I whakahuaki mai o koutou whakaara. Thank you very much for sharing those preliminary insights and observations and aspirations. And thank you all for putting your questions on Slido. I'm going to take a bit of latitude because you've got a number of questions which are doubling up amongst people, but I'm going to ask in reverse order our three guests today a question, starting with Riana and then Ashley and then Minister Little. And the question which has come in is, how can health sector leaders respond to proactively embedding Te Tiriti o Waitangi in our public health system? Ka koe, Riana.
Oh, kia ora, John. Thank you for starting with me first. And I think that that's something that I was alluding to in my previous kōrero, is that the approach we need to take now isn't just one for health. We need to embed, we need to make sure that we're actively embedding Te Tiriti o Waitangi across the public policy system. So that means working really collectively and collaboratively with many parts of the sector. And it's not just about the public service sector too, it's taking those opportunities to work collectively with communities, community leaders, getting down into, you know, if you look at the examples of some of our very rural and isolated communities, that we work collectively and collaboratively with the people who are making decisions in those communities for their people. So I think it can be embedded across all parts of the sector. We must make a collective effort to do so. And of course, like I said before, the opportunities for all of us will improve the health system overall. It's the one way probably to affect the health system with the most might is to bring all of those sectors, housing, kāinga ora, oranga tamariki, all of us together to make sure that when we go on this voyage on our waka haurua, that we reach pai tāwhiti and ensure pai ora for all of our whānau.
Ashley.
Thanks, Riana. So a couple of thoughts here around this question of how do we respond proactively to embedding Te Tiriti or Waitangi. Well, first of all, as public sector leaders, and that's who the question is targeted at, we need to really have a deep understanding of what Te Tiriti is and what the articles are and what they actually mean for us at a personal leadership level, at an organisational level and at a system level. So it's incumbent on us to not only understand that, but to be able to translate that into specific actions, and also what delivery on those articles in the treaty means for whānau and communities, and in particular in the health system, what it also means for the way the health system is structured, so with our mainstream services and our hauora Māori services, but also how the whole system can deliver for and what it must do to deliver for Māori. So for my part, I'm constantly thinking about how do I embed those treaty articles in my leadership at a personal, at an organisation and at a system level. Kia ora.
Minister.
Thanks, John. I think a couple of points I would make is the treaty is about both rangatiratanga and kāwanatanga. So we've seen models where for Māori, with support, it's not just about voice, but it is about voice. It's about decision-making rights. And for Māori to lead their people as contemplated by the treaty. And my expectation is, with the operating model we've got, is that the Māori Health Authority and along with your engagement with iwi Māori partnership boards, reflecting that iwi voice, and the resourcing decisions that the government of the day makes, it takes us a step towards rangatiratanga for Māori. And then I think the other aspect is, we hear this debate about co-governance, is recognising that the treaty always was a shared objective for the Crown and for Māori, and that doesn't change. It doesn't change in the public sector, but the way government, through its agencies and departments, conducts itself can properly reflect what the vision of the treaty was. Māori empowered to make decisions for Māori. I think Riana talked about sharing of power and resources. That is what it is about in the context of the progress of our nation state, Aotearoa, New Zealand, and the two sit very comfortably together, which is what the treaty was always about.
Kia ora, Minister. Kia ora koutou. I'm going to ask a similar question, but in reverse order, starting with you, Minister, and then Ashley, and then Riana. And it's really what you will be looking for as your measures of success. So we're 2 to 3 years into the reforms. What will be some of the things that you will expect to see in the New Zealand health system? Over to you first, Minister.
Thanks again, John. I think what I expect to see is in 2 to 3 years from now, certainly a level of confidence, particularly with kaupapa Māori health providers, but also within other parts of the health system, a confidence about understanding the needs of Māori and fulfilling and building services that help to fulfil those needs. Bearing in mind that the Māori Health Authority is, doesn't kind of stand apart from Health New Zealand and the Ministry of Health. As I said in my remarks, all are integrally involved. They have to be for the total system to work. But the Māori Health Authority brings a mana and a strength that we have long lacked in terms of lifting the performance of the system and providing access to health services for Māori. So I would expect to see data that shows more Māori getting greater access to services. And I think in order to do that, and therefore what I would also expect to see is different types of services, different types of frontline health models providing those services compared to what we have today.
Kia ora, Minister. Ashley.
So I guess the key thing, of course, is, and Mr. Little's touched on this, is that in 3 years, and indeed in 1 year, and I would be impatient for this, is we're already seeing an improvement in equity across the system. So we're seeing more equitable access to, experience of, and outcomes from care, and that we're actively monitoring that. And this is the second point, really, is we've got this constant approach to innovation and improvement. And Mr. Little touched on this, that we're looking at new ways of delivering services and being very responsive, and with this sort of constant desire to learn and improve. And we've seen this a lot over the last couple of years with the response to COVID, the need to respond to Māori and other communities to improve outcomes, the need to deliver vaccination better to Māori and other communities, and the systems being able to learn and respond quickly. And that should be a really strong feature of our system. And finally, and this is important for the Ministry of Health and its stewardship function, is there's a strong future view. It's not just about the here and now. We're actually securing the system for the future in terms of workforce, in terms of the infrastructure, and of course in terms of the way that services are delivered so that they are more accessible to our communities. Kia ora.
Kia ora, Ashley. Riana.
Ai tautoko ana te kōrero, so and I'm really supportive of the comments that have run before. I think when we're talking about better access, we want to make sure that people will be encouraged to get involved in the development of those services, of health and wellbeing services. And I think that's the transformational part that we want to invest ourselves in over a longer period of time. So we have to accept that there is one part which is, what we do right here and now in the reforms, and that sort of transition to the reform. And then there is the work that we'll do to make sure that we transform the system for over a longer period of time. It's making sure that at a really local level, people are able to influence the way that their services will be set up. And this is going to encourage different funding models for kaupapa Māori providers to make sure that they are there, are resilient, are enabled to do the work that we know that they've done wonderfully in collaboration with our local district health boards, Ministry of Health and other ministries at the same time. It's really been an investment in a whānau ora style model, really, because we've seen the whole community wrap around. We've seen really good outcomes for those communities, and that's what we would want to see over a longer period of time as well.
Kia ora, Riana. I've got a question here to ask you, Ashley. how will Māori be able to become better partners in the regulatory and public health space with both the Ministry and obviously the new Public Health Agency?
Yeah, kia ora, John, and this is a good question. As the Minister said, the Public Health Agency will be sitting within the Ministry of Health, and I think about it, of course I would, because I'm a public health physician, but I think about it as being at the heart of the future ministry. Some of its functions will be fundamental to us to be able to deliver on our stewardship role, our monitoring of outcomes and the system performance. Those public health regulatory functions are determined in effect by the Ministry of Health, but they're delivered largely by our public health units. And our public health units will be coming together into a single national public health service within Health New Zealand. And so I think there's an exciting opportunity here for that national approach to our public health service delivery, including the regulatory aspects, the health protection aspects of this, to be much more connected to their local communities, including Māori communities. And in fact, we've seen some very good examples of this, and I talked earlier on about the need for the COVID response to respond immediately to what community needs were. And we saw our public health units having to develop new ways, new relationships with Māori communities and indeed other communities in the delivery of that health protection function. So we've got a really strong base to build off here, and in a way, I think this is one of the most exciting developments I've seen in public health in the last 20 or 25 years that I've been around it, just to see that actually whilst those regulatory functions are prescribed legislatively, they are determined by the Ministry of Health, the way in which they are delivered can and should be done in partnership with communities, and then we get much better outcomes.
Kia ora, Ashley, thank you. Riana, I've got a question here around whānau ora, and in particular the question is asked, will the whānau ora approach be used to assist embedding Te Tiriti in the new system? E whakaaro tau?
I would say that, and I would say that there is always an opportunity to embed whānau ora and the approach it's taken, because again that speaks to that whole collective, collaborative network of providers, of community groups that come together to make sure that they create solutions and establish networks, if you like, for our whānau to be able to access. Because at the end of the day, whānau ora is the aspiration to make sure that our whānau have well-being, that they have a voice, and that's another important part of this reform and how we operate moving forward. So not only do we want to lean into the whānau ora outcomes, which have been very successful to date, we want to also make sure that we establish whānau voice, we listen to the whānau voice, and we enact we build on what they are telling us. So it's a system that is cognizant of all of those factors, John.
Kia ora, tēnā koutou. Minister, I've got a question here around the future for PHOs in general practice, but I think also there's an interest in locality planning, and I'm aware that there's been announcements quite recently around that. But I wondered if you wanted to comment a bit on how you see that moving ahead, particularly with Māori health in mind.
Yeah, thanks, John. I think a really important question. When it comes to PHOs, I think the first thing is to acknowledge that the PHOs, they're not a creation of statute. Government didn't ask them to establish. They rose out of the system as it is at the moment. There was some benefit to offer to provide some support across practices, general practices in a particular area or region. I think the offering from PHOs was to assist with back office functions, support some innovation. And there are some PHOs that have done a great job in doing just that. There are some other PHOs who I would probably say haven't actually risen to the occasion. So what PHOs do is really going to be entirely up to them and the practices that they represent. For me and for the new system, I think the locality planning network process is going to be absolutely critical. The way that process operates is to bring together different health providers in an area, as well as iwi, as well as community leaders, to talk about the health needs in a particular locality, look at the profile of the population, see whether there are things that are distinct to that population, and for that to form the basis of what then Health New Zealand and the Māori Health Authority will fund. From that process, I expect, and if we don't see this, it means it won't be working, but I do expect to see a lot more innovation, certainly a lot more collaboration and coordination. I think one of the challenges for primary and community care, not for all of it, but for some parts of it, is to examine the business models they're operating under the moment, at the moment, and then to think about what might be better ways of ensuring the full range of kind of primary care services that we expect to be in communities can be offered. And bearing in mind that, outside the big metropolitan areas, provincial and provincial urban areas, we've got a large rural population whose health needs have often, frankly, sort of been secondary to what practices might want to do in those more populous sorts of areas. Through locality planning, we have a much greater opportunity, I think, to really think carefully about how we provide services in a more consistent sort of way and reaching to communities that I think for a long time have missed out. If there are PHOs who want to provide the leadership to do that, then that's a good thing, and that opportunity is there for them. But what is critical is, I think, through the way that Health New Zealand and the Māori Health Authority ends up funding services and activities, it drives services to be offered in a way that meets a population's needs, not that meets the service provider's needs.
Kia ora, Minister. Kia ora koutou. I've got a question here around where we see in any change process, particularly obviously one as significant as this, which I think would easily, Minister, be the most significant health changes we've ever had. But there's a question there around where we see the bumps in the road over the next 6 to 12 months. Obviously, as we channel and move towards change, it's important we know the destination, but also where some of those bumps might be. So I might start with Riana, and then Ashley, and then yourself, Minister, about where you think those bumps in the roads might be.
Hi, I think that obviously getting to day one and making sure that we have our organisations established and ready to go is going to be not so much a bump in the road, but it's certainly one of the things that we're really focused and prioritising at the moment. Making sure that we get the right documents, address those priorities, and making sure that we partner up well, both with Health NZ and with the Ministry of Health, to make sure that we're able to roll out those key functions post the 1st of July will also be a priority. Partnership is always about, having those good high trust relationships, working together collectively and working wider with the rest of the sector will be part of our key priorities. So I think the potential for bumps in the road are in any of those spaces, but what I would say is that we're all really committed to making sure that these reforms go extremely well. It's a priority for all of us because at the end of the day we really want to address pai ora, we want to see pai tawhiti regained for our people, and that means being really good te tiriti partners.
Kia ora, Riana. Ashley.
Kia ora.
Oh, kia ora anō. So I'm very conscious as we come to just over 2 years in a pandemic, we have been asking a lot of our health workforce, and in its broadest sense, our public sector workforce as well. And so it's very important that we make sure we are engaging our people who work in the system, and that they have a sense of excitement about the future system and its purpose and the direction, and that they can see the opportunities there and that they can see the aspirations they have, I know they have, for the system able to be realised. And of course that goes in particular in terms of our discussion today about our shared aspirations for improving Māori health and for delivering on our te tiriti obligations. So it will be very important that we create the space for people, even as they are busy and no doubt tired after an amazing effort and amazing work in responding to the pandemic. And also it's important that we're able to articulate to communities, to whānau and hapori, exactly what these reforms mean for them, and are able to demonstrate as we go along the way the benefits of it. But rest assured, of course there will be bumps in the road. We've seen that in our pandemic response. The important thing is that we are constantly articulating that really clear vision, and that people are given the opportunity to respond to that and to engage with the changes that are on the way. Kia ora.
Thank you, Ashley. Minister.
Thanks, Ian. Look, I agree that I think, the for health, the critical element in delivering health services is our health workforce, and we have an absolutely tremendous health workforce that has really delivered in a way that, I think everybody struggled to see just over the last couple of years and really risen to the occasion. But that means we have a health workforce too that is really feeling it, has felt the pressure and is feeling tired as a result. And it's a health workforce that was under pressure anyway. We're a system that still carries a lot of vacancies. So we need to address those issues. They won't be fixed in the next few weeks, but we need to do that. We also need to continue our measured response to the COVID pandemic, as well as facing what this winter might present to us as well. In terms of, look, when you're setting up a new structure and new operating models, there's establishing new relationships, there's reforming old relationships. Those things can happen unevenly. So, look, it's, I think as others have acknowledged, there's no such thing as the perfect process. No change happens in a straight line. I think what's important is we understand the magnitude of the task. We understand the state that the system is in, that the workforce is in. There are still some outstanding issues that I think many in the public and private health workforce would wish were fixed, or fixed some time ago, but fixed sooner rather than later, and I'm determined that we do everything we can to do that. But I think equally as I get around, I think people do see the opportunity of the changes and also want to get on with that. So I think as long as we understand that there are still challenges to rise to, some important tasks to get stuck into, that we support each other to get there, and we accept that it won't be perfect, but it will be headed in the right direction for all the right reasons.
Kia ora, Minister. One question that I'm going to ask, start with you and then Ashley and then Riana, that has been posed is, what happens if there's a change in the future and a change in the policy? And no doubt in recent weeks in the newspaper that's been something that's been posited, but have you got any views or reflections on that before I hand on to Ashley and then Riana?
Yeah, I think I think as the legislation, the Pai Ora Healthy Futures legislation goes through Parliament, I think there'll be more of a public debate than perhaps we've seen up to now. And we should embrace that debate. It is an opportunity to really lay out what we're trying to do here. I'm confident that for those particularly in the health sector who know that we can do differently and we can do differently well and we can do better, that they are willing to seize the opportunity that the changes present. And I also think there's plenty in the community who see that opportunity and want to make the change as well. So I wouldn't get too fussed about what is said in the political arena. I'm not trying to criticise legitimate criticism and legitimate opposition. Of course there is. And as we know in health, nothing is ever going to be perfect. Let the debate unfold. But I think the organisations, Health.NZ and the Māori Health Authority and the revamped Ministry of Health, in the end they will stand for themselves. And I'm confident that even after a year, 18 months operation, we will start to see change and difference and improvement. And that is what will that's what will strengthen the organisations and the new operating model. I detect there is a willingness to embrace the change, and as long as that is there, we will make that change and that will sell itself.
Kia ora, Minister. Ashley.
So the area of the reforms that tends to get the most debate and airtime is around the structures, the organisational elements of the new reforms. But at the end of the day, the thing that our whānau and our communities need and want of the system remains quite constant. And the structural reforms, the organisational reforms, are designed to set up the system to be able to better deliver for whānau and communities. And that's the thing that certainly as the stewards that we will remain focused on as the Ministry of Health, that actually what we're looking for is what are the outcomes we are trying to achieve and making sure the system is delivering those outcomes. And certainly my experience, having spent my career in the health system, is that ultimately the structures are important, but they're not everything. And ultimately it's the relationships that people have at an organisational level, at a service level, at a clinical level, and indeed the relationships that professionals have with individuals, with whānau and with communities that really lead to those outcomes. So my hope is, and certainly the approach we will be taking, is just keeping focused on those outcomes that we all aspire to achieve. Kia ora.
Kia ora, Ashley, Riana.
Hi, and I couldn't have said it better myself. So rather than focusing on the structures, and we know that the structures are one part of the reform, but it's remembering why we've come into these reforms. It's been really, really cognizantly aware around what's led us here in the first place. And we know that for Māori, it is the fact that we are not accessing services in the same way. We're not getting the same outcomes. You know, we have those mortality rates that are so different to other New Zealanders. And this is about exploring and making sure that we, you know, that we start working on the solutions. And that's something we should all get interested in. It's a kaupapa that we all want to have the right response around, which is to make sure we look after all the people of Aotearoa. And we know that if we do get to the bottom of a lot of those kind of, you know, long-term chronic diseases, the mortality rates and other issues for Māori, that it'll actually have a massive benefit in our health system overall. So I'm a little like Ashley in that case. Our job here is to make sure that the relationships are sound, that we're working together really collaboratively, that we're reaching across those other sectors, that we make sure we go back to the communities who most want to be able to stand up these systems for themselves and recognise that there are other ways to make sure that people get the best services as they define them and as they aspire to be able to access them. Kia ora.
Kia ora, Riana. There's a golden opportunity with the reforms, amongst other things, to increase their visibility and awareness, respect for and utilisation of mātauranga Māori and te ao Māori. Advice from you about how those who may not have a lot of experience in that area might engage, Minister?
Yeah, that's a good point. I think, and one of the reasons the reforms set the system up the way they do, and particularly the role of the Māori Health Authority, is that, again, as I said before, it's not just, Māori Health Authority is not just confined to kaupapa Māori health services, it's across the system, because the whole system needs to be able to respond effectively to Māori, draw on mātauranga Māori, and address the needs of te ao Māori. I think one of the jobs that both the Māori Health Authority and Health NZ have as part of their workforce development mandate is engaging with the training institutions, the tertiary institutions that offer nursing courses. And I think one of the jobs I would expect is that we examine closely the training given not just to all health workers who get qualifications, and to make sure that we are providing that basic knowledge and understanding for all those who enter the health workforce with modern qualifications, to understand, you know, what the expectations are, what the needs are for Māori when they engage with the health system.
Kia ora, Minister. Ashley, there's been a number of questions using the big R word, racism, and in particular how it is in the new system we're going to address bias, prejudice, unconscious bias, racism. Do you have some views on how we best go about that, given that obviously we need to do this in a way which keeps the health sector with a purposeful direction and some unity?
Yeah, kia ora, John. This is a really important topic, and as such, it's one of the key pillars of Whakamaua, the Māori Health Action Plan, is actually actively and deliberately addressing racism across the system. And I'll just go back to my earlier comments about leadership and the responsibility on leaders around Te Tiriti. It's at a personal and organisation and a system level that we need to be open to and looking at what are the drivers of poorer outcomes for Māori from the system. And there's no doubt, and it's well documented in New Zealand and indeed many other countries and other health systems, that racism, whether it's conscious or unconscious, plays a role. And therefore it needs to be actively called, and it needs to be actively addressed. And I've been very encouraged over the last 2 or 3 years in particular, John, to see a much more mature system-wide response to acknowledging racism and the impact it can have. Look, I acknowledge it can be a tricky subject. It can be one which people feel quite strongly about, but I do feel we have had a much more mature response to it. And again, it's just us taking specific actions, acknowledging it and tackling it as a very deliberate action. Kia ora.
Kia ora, Ashley. Riana, there's been a number of questions around partnership, and you mentioned before in your opening statements about the close partnership and working relationship between Health New Zealand and the Māori Health Authority. How do you see that partnership being expressed between the two organisations?
So I would expect to see it, expressed in so many different ways. We should be always partnering on setting our priorities, making sure that we develop plans that are going to see better access to services, remembering that health.NZ are going to bring together those 20 district health boards and all of the services that are within there, but there are also the community services and the shared services. So I would see us having a really proactive relationship and good partnership around how we hold ourselves accountable in that system, because the Māori Health Authority will not be, we will not be trumped by the whānau voice. I know that my people will make sure that at all avenues they have the opportunity to make sure that their voice is heard, to make sure that we relay that information to our partners. And that's not just Health.NZ, but of course for our partnership with the Ministry as well as those stewards. So it's, the Māori Health Authority has a big job ahead of it. And of course, making sure that we behave in a way that is partnershipful, that's mana enhancing, that shows manaakitanga to all the parties and our people, will result in really good outcomes. And I just wanted to sort of add to my commentary. Sorry, John, to take the initiative, but you asked a question before about mātauranga Māori, and I think this is one of those really exciting aspects of the reform, is that we're having these discussions. It's one of the if you wanted to see in real time what change looks like, it's the fact that we're having conversations about Indigenous models of care, that we're introducing concepts around mātauranga, that we recognise that when people understand their whakapapa, their history, that it leads them towards well-being in its own right. So there are many different ways. Good health is not just the absence of disease. It's actually making sure that we have good housing for our people, that we are conscious of those who are without, that we make sure that we join together to pull all the levers that it takes to get a healthy nation for all people here in Aotearoa. Kia ora.
Kia ora, Riana. Kia ora koutou. We're coming near the end of the time, but I wanted to leave a final question for you before we close, and that's where you see your particular individual roles in helping to lead this change. So I might mix it up a bit, start with Ashley, and then Riana, and then finish up with you, Minister.
Kia ora, John. Well, in my current role as Director General, obviously there are two elements to that. One is being the leader or chief executive of the Ministry of Health, and in the reformed system, the Ministry, which already has a strong stewardship role, this stewardship role is even stronger and enhanced because we have a really clear obligation to monitor and ensure that the system is performing for all New Zealanders. So that's a really key part of the Ministry's role in the future. And likewise, the Director General has got a system leadership role that goes beyond just being the head of the Ministry of Health. And we've seen the importance of that role through the pandemic. And so whilst I will be moving on from it, I of course am just one Director General in a long line of Directors General, and I know that the person coming into the role will bring new vision and energy and a sense of deep commitment as well to continuing that leadership role across the system. And I'm also very confident, going back to my earlier comments, about the maturity of the system in terms of treaty responsiveness, in terms of its focus on equity, and in terms of partnership with Māori, that the new Director General will carry on that really important work. Kia ora.
Kia ora, Ashley. Riana.
So I see my role as one of being a really good partner, and I think I've said this throughout the kōrero today, making sure that I work collectively and collaboratively with all parts of the sector to ensure that we embed all of these, te tiriti, that we make sure that we take up all of the new opportunities, that we create better plans, and of course that we make sure whānau voice is right at the centre of everything we do. I'm really mindful that the Māori Health Authority at no time aspires to be the voice for all Māori, because our people just won't have that. But making sure that iwi, that hapu, that hapori, they all have the opportunity to have that voice and get their messages and make sure that their aspirations for their people are adhered to is going to be a big part of my role. The last thing I would say is that we have a whakatauki, e harataku toa I te tō takitahi, he takitini care, and that's just simply put means that it's not by the might of one, it's the collective that will get us the resolve we look for. Kia ora.
Kia ora, Riana. Minister.
I think look, I could say I've got the easy job. I've got to receive all the reports and sort of and make decisions. No, it's not. The important role that I will continue to play while I'm in this role is what I've done so far, which is to look closely at the reports, the evidence, and the recommendations, and work with other ministerial colleagues to get some good decisions up that are practical, but that are ambitious, and that actually seek to do justice, particularly to Te Tiriti and to Māori and to all of Aotearoa in New Zealand. I do that by making sure that driving the decision-making process along, that we achieve the milestones that we set ourselves for those particular decisions and those implementation milestones as well. So that's what we've been doing. And I think the other critical thing is to make sure that we continue, as we've enjoyed for so long, to get good people in the right roles to provide that leadership. So acknowledging actually your leadership in the time you've been Director General and just what you have done to really advance the kaupapa of improved Māori health. John, the work you've done as head of the directorate in the ministry and the work on the whakamaua Māori Action Health Plan. And Riana, even before you were in the Māori Health Authority, the work you've been doing on Hauraki as a health leader. And I just could not feel as if the Māori Health Authority is more blessed by having your leadership, working with Māji, working with the ministry, working with the iwi Māori partnership boards and working with your people to really drive the change in Māori health that we know we need to see and that will see us truly honouring Te Tiriti. So I will continue to drive towards those aspirations.
Kia ora, Minister. Kia ora koutou katoa, tēnā koutou, e te minita, Ashley, Riana, tēnā koutou, whakawātea nā koutou, ki te whakahua mai, nā manako, me ngā hua kei te anga whakamua tātou. Nā kia ora tātou. Just on your behalf, thanking again our Minister, the Honourable Andrew Little, Tākuta Arahina Pumuwhera, otherwise known as Dr. Ashley Bloomfield, and Riana Manuel, for their time today in outlining how we are not only going to embed Te Tiriti o Waitangi in the system, but also those expectations that we have moving forward to continue to improve our health system and get the best out of it. On your behalf, I want to mihi to them for their time today and their kōrero, and also want to thank you for the questions and others that you put into this session. I want to close on the point that Riana made, that it takes many of us to come together to achieve what we need to do forth. And I'll close our proceedings this way. Kia hora, hia tonutia, nā manaakitanga o nā hua nui ki rungi a tātou katoa, mai a rangi nui e tui honei, mai a papatua nuku e takoto. Kia hora te marino, kia whakapapa pauna mui te moana, kia tere te kārohi i mui te haerenga o tātou, kia tau, kia mau, kia pupuri, kia whakamaua, kia tūna, haumi e, hui e, tae ki e, e nohora i o koutou kāinga.